Hi, my name's Ben. Thanks for tuning into my presentation on how dementia risk from poverty-induced life stress can be reduced with a community-specific intervention approach. So the NIA defines dementia as a debilitating health condition that's caused by many different diseases, resulting in loss of cognitive abilities such as memory and problem solving, and it really reduces independence and quality of life. The CDC projects dementia rates in America will double or more by 2060. And so this is very much on the forefront of healthcare workers and policymakers' minds, but data shows population disparities in dementia risk. For example, African Americans are 60% more likely to develop dementia than white Americans, and Americans living in an 11-state region in the South called the Stroke Belt are significantly more likely to develop dementia than the rest of the country, especially Black Americans in this region. So there's a strong correlation between populations living in poverty and dementia risk. Slavich defines life stress as cumulative stress caused by internal conditions and external events and conditions. And we all use coping behaviors to deal with stress, and people living in poverty experience higher rates of stress, and therefore they have to use more coping behaviors to deal with this. And there's healthy coping behaviors like confiding in social support systems or seeking, mental health services, and unhealthy coping behaviors such as, regular unhealthy binge drinking, and which itself adds to both stress and increased risk for cognitive decline and dementia, which I'll talk about in my conceptual model. So research shows that high life stress is correlated with poverty. This is obvious. But what's less talked about is how life stress is correlated with increased risk for cognitive decline and dementia. This is explained scientifically through increased cortisol levels, it's a stress hormone, leading to dysfunction in the hypothalamic pituitary adrenocortical axis. It's a stress regulation center in the brain, and this is proven to lead to higher rates of cognitive decline and eventually dementia. Research also shows that stress in individuals living in poverty, in America specifically, especially in African Americans who are twice as likely to develop dementia, that leads to higher risks. And African Americans research reported both higher life stress and, as highlighted earlier, higher rates of dementia. So previous interventions on this topic include an intervention where community leaders were equipped with skills and resources to teach individuals within groups skills for their own level and for collaborating with others, how they can share experiences and handle their stress. So basically teaching positive stress coping behaviors. And I like this one because what was measured was cortisol levels, which is an objective measure about stress, as well as reported acquisition and use of the coping skills. Another intervention involved family-centered stress prevention, and this was another randomized controlled trial where parents were equipped with skills that allowed them to be more supportive of their children and reduce burden of stress on their own lives and of their children's lives. And this is interesting because the authors talked about how epigenetic aging related to life stress and eventually cognitive decline begins as early as adolescence for people growing up in poverty. And finally, one that I liked was a manual-driven, curriculum-based intervention, which helped, again, group sessions where participants were given skills to identify resources they can use to reduce stress and access resources that they were not aware of before to reduce stress. And this was measured through questionnaires about their psychosocial well-being and knowledge about the effects of poverty. So I used the social ecological model in this intervention. I liked it a lot because with dementia risk, this is very obviously an individual level item, but it's mediated by all of these things, but I really focused on the organizational level. I really focused on the interpersonal level, which is your social network, your neighborhood, your family, your friends, as well as your broader community and the values and norms that you share. Maybe expectations for how you deal with stress, or even if you acknowledge stress in your life. So the key components to my intervention is that it would aim to change individual behavior through social levels. This is tied to the ecological model and really just is the idea that individual stress and risk for dementia can be adjusted by the amount of support you get from your family, your friends, the organizations that you're a part of, and mental health services available within your community. And another really important aspect of this is that the intervention is community specific. So that the intervention is built within existing organizations like churches and other organizations that exist that people are already a part of, and is led by individuals who are already part of that community and have rapport with the community. So this is highlighted by multiple constructs within public health. So there's the social ecological model, obviously, interaction between individual, interpersonal, and community levels. It's also related to system theory and perspectives. A community leader who's already part of the community is going to be a lot more effective at discussing and leading discussions about stress from poverty if they've lived in that community and understand what people are going through, compared to someone from outside bringing in theory or something like that. And research suggests that this is more effective. So basically, with this intervention, the goal is to reduce the use of negative stress coping behaviors, such as like binge drinking that I mentioned earlier. And that's binge drinking is something that both directly increases risk for dementia, it alters your brain, and increases life stress because it's very cyclical. And as well as increasing positive stress coping behaviors, could be, how do you confide with others about your stress? How do you handle it? What techniques could you use to relax? Mindfulness, meditation. It's not an answer to the problems of poverty, but ideas that could help people handle the stress, while other interventions directly try and change the effects of poverty, if that makes sense. So, and finally, components of this intervention are related to knowledge and about empowering people with knowledge, both related to how stress increases risk for dementia. This is perceived susceptibility, and a lot of people aren't aware about their correlation between stress and dementia, and as well as knowledge of what mental health services are available in your area and how therapy or counseling could help reduce your life stress. And I think people are scared of dementia, so just being aware of that you can actively reduce your risk for it is important. So within my conceptual model, I talk about the individual level, so your biology and genetics that dictates both your current life stress and your cortisol levels, as well as your risk for dementia. Life stress, the main idea is that life stress mediates risk for dementia, your individual experiences, but then your individual stress coping behaviors are a big focus of this intervention. So environmental stress leads to life stress, and it leads to stress coping behaviors. And this is something that I feel like is one of the most easily changeable things, just by teaching about the risks of negative stress coping behaviors and introducing positive ones. And this can be done through various support systems, like I discussed earlier, like support groups, community support systems, and increasing knowledge of access to professional mental health services. So measurable constructs and outcomes in my intervention would be reducing cortisol levels, that's the objective measure, reducing alcohol and drug consumption, this could be measured through questionnaires, and increasing use of positive stress coping behaviors, as well as, this is back related to knowledge, increasing individual awareness of mental health services, how you can reach services to receive counseling or therapy, and finally, just increasing understanding that life stress is there, and life stress leads to dementia specifically. And again, this is something that I feel like most don't know and is something new in this intervention. So again, thank you for listening. I squeezed everything into 10 minutes. I know I have a lot of shifting around to do, and I felt like I was rushing, but thank you again for listening. Looking forward to your feedback.